nations world over commemorated the World AIDS Day, forming a united front in the fight against a virus that has eluded scientists for 34 years now.
Excuse me, miss.
In Kenya, it continues to pose a great health challenge, with the youth at the greatest risk.
The average is that 97 young people in a day get infected with HIV.
The Kenya AIDS Response Progress Report of 2016 indicates that of the 97 infections among the youth daily, 2/3 are girls and young women. Young female adults account for 33% of the country's total new infections.
We are very concerned about this, and we know that if it is left unchecked, there's a threat to the great strides that we have made so far. Guaranteeing the rights and empowerment of young people in this generation is a moral obligation, a development imperative, and a smart investment that will safeguard the health of youth in Kenya.
Various prevention approaches, including condom promotion, voluntary medical male circumcision, pre-exposure prophylaxis, HIV treatment, HIV testing, and behavior change, are being scaled up to reach more young people. But as the awareness campaigns continue, scientists continue to burn the midnight oil in the search of a vaccine that will end the spread of HIV. A clinical trial to assess whether an experimental HIV vaccine is safe and able to prevent new infection is now on in South Africa.
A vaccine with the potential to prevent HIV for good.
We have built a vaccine that contains very small pieces of HIV. The vaccine is completely harmless, but is able to elicit the immune responses against HIV that may potentially protect the individual should it encounter the real virus. And we are using a virus that has been made completely innocent.
2,600 HIV-negative women from South Africa, Zimbabwe and Mozambique will take part in this large-scale study known as Imbokodo.
Because of the number, we assume that it will take us 15 months to bring all the participants in. And our vaccine regimen is quite long, so it will take us 48 weeks to give the 4 doses of the vaccines. And of course, after that, we will need some time to see whether the immune responses that we have elicited are indeed protective.
What makes you feel or believe that there is greater potential in this vaccine candidate compared to others that have been tried before?
The differentiation of our vaccine is that it gives higher immune responses and specifically higher antibody titers, and we have demonstrated in animal studies in which you can also expose the animals to HIV. We have shown in those models that these antibody titers are crucial for the protection.
Johnson & Johnson, the Bill and Melinda Gates Foundation, National Institute of Health, together with a consortium of global partners, are part of this initiative geared at developing a global vaccine that could prevent a wide range of viral strains responsible for the HIV pandemic. At least 1.5 million Kenyans are currently living with HIV. However, an estimated 72,000 Kenyans get infected with the virus every year. Sylvie Chebet, Citizen Weekend.